My work here is really very simple, is to welcome all of you today to the launch of the East African Commitment to Reducing Inequality report.
So just to pose the question, what does an ideal equal world look like? Because we're here to talk about reducing inequality across East African countries.
For me, the ideal is just to have everybody 3 meals without them having to think about where that meal is coming from. People to have enough water, people to have enough, just simple life.
I think the Horn of Africa over the past 2 years has gone through a lot. I think we've seen COVID-19 starting in early 2020, the locust infestation in the Horn and East Africa, and then we have the ongoing drought, among other climate change challenges that we face as a country. These multiple shocks have not only exposed, but actually increased the inequality that we see from the numbers that we see churned out by the World Bank, IMF, the Kenya National Bureau of Statistics, Oxfam, and others. As we speak today, 2.9 million people are severely affected by the ongoing drought in this country. During the COVID-19, the World Bank estimates like 2 million people lost jobs as a result of COVID-19. And at the same time, Oxfam has published a report on inequality that shows the wealth of the top richest people really went up doubly, especially the top 10%.
Now, the questions that you must ask yourself is not just existence of inequalities, but some of the factors that contribute to the existence of those inequalities. So within the Constitution, Chapter 10, you will see public participation captured there under the values that will form and shape the Kenyan governance, architecture, and culture. So that everything we do as a people of the country of Kenya, we ask ourselves, to what level are we engaging the public in the spaces we are occupying? The second measure that Kenya took was the concept of devolution. Decisions are made by those most affected by the impact of those decisions, and flexibility and space is created for them to speak into that space. Through the Equalization Fund, Kenya government commits that 0.5% of all the revenue that is collected by the national government, as reflected in the audited reports approved by the National Assembly, that 5% of the resources there will go into marginalized areas, as again identified through the guidance of Commission of Revenue Allocation, and again approved by the National Assembly.
The key messages of the report are that East Africa was already doing relatively poorly in combating inequality before COVID hit. As a result, it was very poorly prepared for COVID. COVID is dramatically worsening poverty and inequality, but as far as we can see, the only new measures taken to act against that is what looks like in most countries to be a temporary increase in health and social protection spending. Fourthly, that austerity is forecast to kick in hard in many countries and will make it impossible for countries to achieve their national development goals and the SDGs. And therefore, finally, we're saying in the report that governments supported by regional organizations, the IMF and the World Bank and the international community, need to take urgent actions now to reverse austerity and decisively reduce inequality if we're going to have any chance to reach the SDGs and end poverty.
Uganda, we don't have a minimum wage. Now that puts Ugandan workers at a very, very awkward position. The government itself has a problem with paying its own workers. So what we are trying to do now is to ask our members of parliament now, who are supposed to take that law back to parliament, look at areas where the concerns of the government, then we harmonize our position and the government, ensure that we come back with it and the parliament can pass a law that is acceptable by both parties.
The recovery phase is a great opportunity for East Africa governments to leave no one behind And in this, participation is crucial. Participation of especially those most affected, of children, of women, of girls, and making sure you bring them forward as key actors in terms of planning and implementation of any recovery plan. They must be on the table of conversation in the recovery process. And there has also to be constant review mechanisms to ensure that any form of gender disparity is addressed timely.
Women in Kenya play a key role in responding to diseases. And we know very well that during the pandemic, many women, even if they were working, they stayed behind to become caregivers. They are the primary caregivers and the frontline health workers. So women should be put at the center of the response to pandemic, of moving forward. Women should be at the center. It's like everything oscillates around the life of a woman.
My urge is basically that can we be able to honor our global commitments, to apportion our budgets to health, to enable, to relieve our population from incurring more expenses to meet the health needs. Otherwise, we continue making them poor. As we discuss about the budget increments, we should also have legislation to seal the leakages.
Government working with development partners like Oxfam came out of their way to support government by giving either the goat and the cows that had missed. And people felt, yeah, we are appreciated. So thanks, Oxfam.